And this next part of the assessment is really a two-part assessment, and we're going to look at everybody's favorite muscle, the abdominals. And we're going to break this down into the upper abdominals and the lower abdominals. So for both parts of this test, you're going to be laying on your back. In the first part of this test, we're going to test the upper abdominals. Lay flat on your back. You're going to put your hands behind your head in the full Nelson position. Sit up off of the table. While you do this, you're going to keep your legs straight. This is the challenge. If your legs are able to stay straight and you're able to sit comfortably up in this position, this is going to be considered a passing test. If you're unable to sit up straight comfortably in this position, or your legs bend or come off of the table, this would be considered a failing test or needs improvement. If you're able to sit up straight and keep your legs flat on the table, and also slowly return your body back to the table, leading with your lower back, then the middle of your back, then the upper part of your back, and then touching your head down to the table. If you can do that in a slow and controlled manner, that would be considered a passing test for upper abdominal strength. In the second part of this test, we're going to look at lower abdominal strength. And again, laying on your back, you're going to keep your knees straight and you're going to raise both of your legs together above your belly button. Your feet should be facing towards the ceiling and your lower back should be resting comfortably on the table. You should feel when your legs are up in the air that you have pressure on your lower back. If you need to test to see if you have pressure on your lower back, you can bend your knees, bring them up to your belly, hold them in, and then put your hand underneath of your lower back to feel where that pressure is on the table. To start the test, you're going to start with the legs up in the upright position above your belly. Remember, you're going to keep your knees straight and then you're going to slowly lower your legs down towards the table. What we're looking for here is that your lower back is able to stay on the table. If your lower back starts to arch or your pelvis starts to arch and come off of the table at any time during this test, or if you have pain in your lower back or your hips, this would be considered a failing test. A passing test would be considered if you can lower your legs the whole way down to the table without arching your lower back, keeping that pressure of your lower back firmly pressed into the table.